Yeah, I think I would try to say that, very importantly, to recognize the role of the rapid response teams and engaging early with families and patients on the ward, is a really good opportunity for us in critical care to positively influence end of life care, because we can do a lot. And I think, we do some of our best work in end of life care, not even in the ICU. So I would emphasize that. I would emphasize that when we have end of life practices, to make sure that we are there at the bedside as much as possible and engaging with family members and making sure that we have clear orders, clear rationale for giving medications so that there's no misunderstanding and that everybody's on the same page. And then finally, stay tuned for some bereavement supports, and don't make that the blind spot where we sort of lose track of families, because I think we're going to learn an awful lot about how big a deal complicated grief is, and hopefully how much we can do to improve it, because it's a big deal, and we have a long way to go.